Hello everyone, welcome back to Pathomad. Today I want to discuss about an interesting case that was presented to our department. Firstly, a 62-year-old male came with complaints of swelling on the left side of the neck since 10 years. This is the neck swelling on the left side. So on examination, it is a 6 by 5 centimeter swelling noted over the left side in the subcutaneous plane, which is soft to firm in consistency, and it was freely mobile. So we have done an FNA's fine needle aspiration cytology for this patient. For this FNAC, we aspirated 5 ml of brownish fluid. Upon preparing the smears, so this is the smears that were prepared from the FNAC sample, and we could appreciate the cyst macrophages. These are the cyst macrophages, cyst macrophage, and few hemosiderin-laden macrophages, this brown pigment within the cells, and this irregular nuclear membrane. The nuclear membrane is irregular, and few binucleate cells. But this cytology was inconclusive, and we have advised for a biopsy for this patient. And this patient underwent excision of the swelling, and the specimen was sent to histopathology. So this is the gross image of the specimen. So it is a single cystic mass. It was measuring 7.5 into 6.5 into 5 centimeters. This is the cut section of this specimen. It shows the cystic spaces. There are few cystic spaces, and upon cutting, brownish fluid was flowing from that. It's like a typical sapota color, chiku color fluid was coming out of it. And this is central papillary area. It was measuring about 2 into 1.5 centimeters. This is one chunk or one slice of it. I have taken one slice and it was showing this. Numerous cystic spaces was there. Few spaces when it was like filled up with this green jelly-like material. It was like green jelly only. And the fluid coming out of it was a typical sapota color fluid, brown color fluid. Sections were made from all over the rim. All over the rim sections, we took bits from all over the rim and from the central papillary area. This is again in my hands. I have taken this cut section image. It was properly fixed after 2 days or so. So you can appreciate this dark green jelly like material filled within the follicles, like within the cystic spaces. Few empty cystic spaces were there. Central papillary area. See cystic spaces. Few spaces filled up with this green color colloid-like material, almost like colloid-like material. We were not sure. I mean, the clinician has not mentioned about what is this exactly. They have sent just swelling of the neck under evaluation. So we could not identify which structure it is, like a lymph node or thyroid, what structure it is, we could not tell. But upon cut section, these features we could identify. On microscopic examination, this is a scanner view, that is high power, low power view, showing this is a typical lymphoid structure. See, this is the lymphoid capsule. You can appreciate the capsule. This is lymphoid structure with the germinal centers. Germinal centers are there. And within this lymph structure, we have this thyroid follicles. These are the thyroid follicles. Colloid-filled thyroid follicles. See, this is again the high power view of the lymph node structure. It shows you this germinal centers. Germinal centers are there. This is again a high power view from the tumor area. It shows tumor cells within this. This is the fibrovascular core, and the tumor cells are arranged in papillae, like finger-like projections, papillae, classical papillary structure. Papillary structure. This is again in one of the cyst. We can find this summoma bodies, like concentric rings. Summoma bodies. These are the summoma bodies. This is from the cystic spaces, cystically dilated follicles, and you can see hemosiderin-laden macrophages, means the brown color pigment. Here it is like dark pink stained. The typical dark stained dots, these are the hemosiderin-laden macrophages. Here again, one of the cysts shows the papillary pattern of growth. This entire thing is the cyst. This entire is the cyst. Within the cyst to the lining, you see is papillary growth, papillary growth, papillary growth. And the impression was given as the metastatic deposits of papillary carcinoma of the thyroid to lymph node. Since we could identify the lymph node with the capsule, and within that structure we can identify the thyroid follicles, it was given as the thyroid follicles which are arranged in papillary pattern. It was given reported to be the metastatic deposits of papillary thyroid carcinoma to the lymph node. Thank you all.